how should we form the totality? Because Kent has said a well taken case is a half cure. Okay, we have taken a good case. We have put down the things on a paper. Then what? These are the usual phenomena that we have to do the arrangement of a data. A first important aspect for creating a totality, put down the data in a form of what are the causative factors, what are the maintaining factors, what are the modalities which is aggravating, what are the modalities which is ameliorating, and then importance of location. I think all of us have studied the gelsemium in a such a way, chelidonium in a way that the pain in a liver, right side of liver going to the scapula, in between the scapula, and this is a very important aspect on prescription of a chelidonium. The sensations, the general sensations of a burning in cases of sulfur, phosphorus, arsenic, right? The modalities can be up at a various level. It can be at the level of emotional, can be level of intellectual, or can be level of physical. Modalities means it can be elements from, can be aggravating, can be ameliorating. And we should give respect to that, because when you do the evaluation of a case, then it will go a higher archery. And how can we forget the important contribution of Burning Hussain and Boyd related to the concomitant, right? Because it is extremely important that concomitant suggests what? We should have a clarity of that. Concomitant suggests the individual future. Mind well, it is not a futures of a disease. It is a futures of an individual. So it gets a utmost important in a case. And when we evaluate a case, when we try to create a totality of the symptoms, concomitant will go a higher up. It speaks of an individual. And the most important aspect of concomitants is that Boyd has focused that the mental concomitants are extremely important. It should get a maximum importance in cases of physical disease, and if the case is of a mental disease, acute disease, then the physical concomitants are very important. And mind, keep these into the mind, because in a cases we are going to demonstrate this. Yes, we have understood the importance of modality, right? Modality can be at any level, emotional, intellectual, and physical. But the most important aspect in four column or location, sensation, modality, and concomitant, because it gives us a complete symptom. And when we have a complete symptoms, Bonnie Hussain has said us that, okay, we can treat either acute case or chronic case without any difficulty. So keep into the mind that importance of complete symptom, which always guide us for a selection. And the most difficult, dear friends, it is more difficult to observe the infant in agony, children and comatose patient. What you will do? Because either child is crying, what type of crying it is? It's a piteous crying of a pulsatilla, or it's a irritable, snappy child of a chamomilla. We have to observe what you will do in comatose patient, where you will go, how will you collect a history, give a maximum importance to the objective data, and that we will see into the cases which is going to come, right? So keep that into the mind, importance of observation in clinical practice, specifically in the cases of acute dimension and even chronic also. How behaved patient, how he is narrating the complaint, and the evolution of the complaint. That is of a utmost important for a selections of remedy. The next important aspect is understanding of a concomitant, because concomitant often unlock the case. And if we are able to recollect that, the importance of keynote symptom, Honeyman has said, and later on the Allen has also said that okay, three keynotes are important for prescription. I would say for a successful prescription, three keynotes out of that two are general and one is of a particular. Concomitant can be your keynote. And Boyd has beautifully said that importance of mental concomitant in physical illness and importance of physical concomitant in mental illness. And I will take you to that journey in number of cases which is going to come. So please be alert, keep this into the mind and see that how it unlock the cases. Now, the most important as a homeopath, what to do, how to do, and where should I go? Should I, in a time which is given, should I go to the repertory? Yes, repertory is the most important aspect. And first and foremost, one should go to the repertory after creating a totality and then go to the materia medica. And you see, if you are able to get this right remedy, there are minimal difficulty. Keep this word, get yourself ready to have a journey. Cases of infection, cases of fever, cases of psychiatric dimension, cases of coma, and whatever master has said, the importance of aphorism 1 to 6. What is aphorism 1 to 6 speaks of a the permanent, gentle, rapid cure, and how we should have become an unprejudiced observer in treating a various acute cases. Right? 1 to 6 is a heart of the entire organon. If we are able to understand aphorism 1 to 6 in our life, the in our practice, I think the failure is minimal.